My name is David Osuji, your psychiatric mental health nurse practitioner. Did you know that the balance of just two hormones can impact your resilience, focus, and even how you handle stress? Today, we're diving into a crucial topic: how balancing testosterone and estrogen can affect men's mental and physical health. So, testosterone is often considered to be the male hormone because it is tied to things like muscle building, sex drive, and energy. But it is only one piece of the puzzle. Men also have estrogen, which is typically considered to be the female hormone. Though estrogen is present in men at much lower levels, it is still an important player in our balance of hormones because it is responsible for things like bone health and even sperm production. Think of testosterone and estrogen like yin and yang. They work together to keep our bodies functioning at its best. But when this balance gets shifted or tilted, like when estrogen levels become too high and testosterone levels become too low, men can start to experience symptoms that might seem unrelated but are actually directly tied to their hormonal health. One key player in this balance being off is an enzyme called aromatase. Aromatase converts testosterone into estrogen, and when aromatase activity is really high, it starts lowering testosterone by converting too much testosterone into estrogen. I'm going to say that again for emphasis. When aromatase activity is really high, it starts to convert testosterone into estrogen. So the more aromatase activity you have, the higher your levels of estrogen, which conversely means the lower your levels of testosterone. Let's talk about why this matters. When men have elevated levels of estrogen, it can lead to some noticeable changes, both physically and emotionally. For a man who has high levels of estrogen, you might experience symptoms like gynecomastia, which is a big fancy word for saying enlarged breast or chest tissue. You might also experience things like mood swings or increased irritability, low energy or fatigue, decreased libido, and even erectile dysfunction. Now you might wonder, how does this hormonal imbalance happen? Like, what causes it to happen? One major factor is body fat. When we carry excess body fat, especially around the belly area, it increases the activity of aromatase, which ramps up the conversion of testosterone to estrogen. So the more body fat you have, the higher the activity of aromatase, which means the more estrogen you will have, because aromatase is converting testosterone to estrogen, which conversely means higher estrogen, lower testosterone. Imagine you're trying to stay motivated, push through stress, or keep your energy up during a challenging day. When your testosterone levels are low and your estrogen levels are high, that ability to be resilient becomes a lot harder to sustain. The ability to face difficulty, to push through, to actually do difficult things gets a lot harder because your levels of testosterone are low and your levels of estrogen are high. So it's not just about physical health. This imbalance directly also impacts your mental endurance. In part 2 of this series, we'll explore how testosterone levels influence our stress tolerance, motivation, and focus. Plus, we'll break down how diet, exercise, and lifestyle choices can help support a healthy hormonal balance. Thank you for tuning in today. If you're interested in optimizing your mental health and resilience, stay tuned for part 2. And as always, like and subscribe and share this message with someone who you think will appreciate it. See you in the next video.